The health, the radiation effect of the health are of three types. One thing is cell death, then cell transformation, or it could be combination of both of these. Now, what is the radiation health effect to continue? These are deterministic, that is the threshold, or non-stochastic. Then next is existence of a dose threshold value. Then is the severity of the effect with increasing dose. Then is a large number of cells, if they are involved, what will be the radiation effect on them. This is just to show you that radiation effect can be very severe, and the picture shows it. There has to be a threshold dose for deterministic effect. Now, for cataract of the lens, it is 2 to 10 gray. For permanent sterility in a male, it could be 3.5 to 6 gray. In female, it is 2.5 to 6 gray. In other words, if the lens gets 2 to 10 gray exposure, it can develop cataract. Males can develop sterility if the dose is in between 3.5 to 6, and female it is 2.5 to 6. Then there can be temporary sterility. In males it is 0.15 gray, and in female it is 0.6. Now, what we do here, if we find that somebody has exceeded a radiation dose, they are kept away from the radiation, and with the subsequent days they recover from the effects of radiation, because radiation is a cumulative dose. Now, what are the stochastic effects? Stochastic effects are non-threshold. They do not depend on the threshold. Then the probability of the effect increases with the dose. Generally, it occurs with a single cell. Now, there can be e.g. cancer, there can be genetic effects, or there can be multiple other effects like we have already described. Now, what happens is when a radiation comes, it hits the cell and subsequently it hits the nucleus. What can happen with it? There can be no change in the cell, no change in the nucleus, or there can be DNA mutation. Now, we are more worried about this DNA mutation. Now, what is the outcome after the cell exposure? Damage to DNA. Now, DNA is exposed to the radiation. The damage can be repaired by the body. Then this can be cell necrosis, there can be apoptosis, then there can be transformation of the cell into some other cells. Now, chain of events following exposure to localizing radiations are described in this chart. First, the exposure will be there, then there will be ionization, then there will be free radicals, that is the chemical change, then there will be molecular change, that is in DNA, RNA, and in enzymes. Then there can be a subcellular damage, that is on the membrane, nuclei, and on chromosomes. Then there can be a change in the cellular level, that is cell death and cellular transformation. Now, what is the radiosensitivity? Radiosensitivity usually is required to know whether the side effects will be with a small dose of radiation. Now, highest radiosensitivity is with the bone marrow, spleen, thymus, lymph node, gonads, islets, and lymphocytes. They are most sensitive. High sensitivity, highest sensitivity is we have to protect them maximum. Medium is with the skin, mesoderm, organs like liver, lungs, and low is for the muscle, bone, nervous system. What it means that if there is a small dose of radiation, even then the organs in the left hand chart has to be sensitively more monitored and more protected, and that of the right side they are less sensitive. So one can be little bit sure that even if there is a small radiation, nothing will happen to them. Now, what are the radiation effect? One is deterministic effect. What are the deterministic effect are? Radiation sickness, radiation syndrome, then hemopoietic system can get affected, that can lead to anemia, then GI symptom and CNS syndromes. Then damage to the individual organ can occur. It can even lead to death, but that much radiation is never given to anybody, nor nobody can face it. Now, what are the stochastic effects? They can be chromosomal damages, then there can be cancer induction, but that needs many years and lot of exposures. It is not an immediate effect. Then can be genetic effect, then somatic mutations can be there. That is what we can see, a genetic effect. Now, what is the objective of radiation protection? Is the protection of the deterministic effect, because they are very severe. The limitation, the probability of stochastic effects, if not completely, we can just limit them, we can reduce them. Is there any area without radiation? Okay, if we think that if there is any radiation free area, we can go and stay there, but there is no area on the earth which is free of radiation. We always live with 1 to 3 MSV radiation, and what kills is the 4000. So, it is 4000 times what we are facing every day is required. So,